Hello everybody. With this presentation we're going to cover three principles of biomedical ethics. The principles we're going to talk about now are beneficence, non-maleficence, and justice. Those are principles that are going to enable us to make moral judgments with respect to what is the right thing to do in the context of ethical dilemmas that arise in the context of healthcare. We are all familiar with the saying that comes from the Hippocratic Oath, first do no harm. That saying translates into two principles in biomedical ethics: the principles of doing good and the principle of avoiding harm. Both of these principles are focusing on the consequences of an action when they are making the prescription of what the right thing to do is. So they are principles that are articulated within a consequentialist framework. So the principle that tells us do good is known as the principle of beneficence. We say a good action is an action that brings about some benefit. It provides a benefit to the patient, it provides a benefit to the profession of the healthcare provider, it provides benefits to the family of a patient, and so on and so forth. So beneficence looks at what good comes out of an action. And a lot of the benefits that are going to be concerned are going to be things that patients and healthcare providers value. We've already talked a lot about a number of values that inform our decisions. And here, just as an example, the value of health is going to obviously be key component of determining what's beneficial in a certain context, but also aesthetic values are going to be often intertwined in these decisions. And when we talk about aesthetic values, one obvious way in which they are going to affect the decisions of the patients is how the patient appearance is going to change based on some treatment or other. But also we talk about aesthetics when we look at the pleasure and the well-being of a patient, because those are values that rely on the goodness that comes of an action that brings about some nice feeling, whether that would be the beauty of an object or the beauty of a person, or that would be the pleasure that we get out of some sort of experience. So on the other side of this consequentialist framework, we have the principle of non-maleficence. That's a principle that tells us we need to avoid harm. First, do no harm. So here we're looking at what actions are going to minimize the suffering of the patient. What actions are going to be such that even if some harm comes out of them, the benefit outweighs that harm. So when we start looking at this kind of balance that we need to strike between benefits and avoiding harm, we are seeing how the principles of beneficence and non-maleficence could just be two sides of one coin. But there are going to be situations in which both of these principles may be in conflict, and we're going to look at examples later on. So these two principles, let's summarize, are principles of consequentialist framework. One of them tells us that the right thing to do is what brings about a benefit. That's a principle of beneficence. And the other principle tells us that what the right thing to do is what is going to be the action that avoids harm or at least minimizes harm. So that's the principle of non-maleficence. So now let's see what kinds of situations we may observe in which there are going to be ethical dilemmas in the choices that patients and healthcare providers have to make. So there are two perspectives that don't necessarily overlap. We have the perspective of a healthcare provider and the perspective of the patient. And the perspective of the healthcare provider is that the main goal is to maximize the health of a patient. And that goal is informed by the value of health. So the healthcare provider values health first and foremost. The healthcare provider has signed up for treating a patient and providing optimal care and helping the patient restore health. On the other hand, the perspective of the patient obviously is to regain health, but not at any cost, because the perspective of the patient is such that the patient wants to maximize the overall well-being. So if there's a trade-off between some treatment that supposedly is going to restore the health of the patient, but that's going to come at the cost of some other value, the patient may opt out of that treatment. So take for an example, a lingerie model who needs an open heart surgery, which is going to leave a big scar, and that's going to significantly change her looks, which is most likely going to affect the job opportunities that the model has. So here we're going to see that from the point of view of the healthcare provider, the surgery is what needs to be done as soon as possible. But from the point of view of the patient, it may be that they will want to postpone as much as they can that surgery so they can practice their own profession. So in this case, we're going to see that an aesthetic value, the looks of a person, as well as their professional values, are going to be in conflict with the value of health. So the trade-off is going to have to be carefully weighed before the decision could be made. So one very clear case in which the principles of beneficence and non-maleficence are involved is the so-called enhancement debate. When we talk about enhancement debate, we're looking at the controversies over using medical procedures, medical treatments for some kind of non-medical benefit. And one significant case of using medical treatments for recreational purposes, for example, is when people misuse pharmaceuticals. We're very well aware of the opioid epidemic that is devastating the United States currently. And here we have a case in which there is a medical treatment, a painkiller medication, which is misused. It's taken for non-medical purposes and obviously brings about very bad consequences. So here there's a huge moral dilemma when a healthcare provider has to prescribe a medication. Should we make sure that the person is taken care of health-wise, or should we trade that off with the person's suffering in the case of not getting a prescription, but at the same time avoiding the harm that comes with drug addiction, which potentially can happen if a patient is prescribed opioid medications. So another case in which we are looking at the possible benefits and harms that come out of a non-medical use of a medical treatment is when we look at people's enhancing some kind of biological capacity that they have based on some medical treatment. And one very well familiar example is the example of physical enhancement. That's when athletes, for example, take steroids in order to perform better. Now, clearly, they do not need the treatment for purposes of restoring health. The purpose here is to gain some professional recognition, to make some professional achievements. So it's not a medical value that informs that decision. But here's the ethical issue. If we allow athletes to take steroids and compete this way, there's the issue of fairness. Not all athletes are going to be taking steroids, which means that that's not going to be a fair game. Some individuals are going to be to have an advantage over others based on the enhancement that they have made using steroids, which obviously is not fair. But then we may say, well, let's then let all athletes take steroids. But here we're going to put pressure on individuals who do not want to undergo these treatments. So that would mean that they're going to, again, be in a disadvantaged position. So maybe they value their health more than their professional achievements, but that, again, is not fair. One other issue with fairness in this case would be that wealthier people are going to have better access to these treatments, and athletes that come from disadvantaged backgrounds would not have that option. So here we see how we get a medical procedure that leads to an ethical dilemma. Some important decisions have to be made. So another kind of enhancement is the so-called cognitive enhancement. When we talk about cognitive enhancement, we talk about people taking some sort of medical treatment for the purposes of enhancing their cognitive performance. And one kind of cognitive enhancement is the pharmacological enhancement. So drugs that are developed to help people with learning disabilities or attention deficit, drugs such as Ritalin are prescribed to individuals with those disabilities with the goal of restoring their capacities so they can reach the capacities of the average individual. So in that sense, taking a medication for that cognitive disability is going to restore fairness, because now we have individuals who can compete with others academically at the same level. However, it is not an uncommon situation in which students, college students in particular, are taking these medications when they don't need them with the goal of enhancing their own cognitive capacities. People often take these medications when they're trying to meet a deadline and perform better on an exam. It is not only college students that abuse these drugs. Those drugs are also known to be taken by professors. So it is a situation in which some people use this kind of enhancement and get an unfair advantage. So again, some similar issues are going to arise in this situation as the issues that were looked at when athletes take steroids to get physical enhancement. So again, people with wealthier backgrounds are going to have better access to medication. Again, people who do not want to take these medications are going to be disadvantaged. When it comes to competitive context and academic context, is clearly a competitive context both for students and professors alike. So here again, we have a medical treatment that is triggering a lot of ethical dilemmas. In addition to pharmacological cognitive enhancement, many people are developing technological enhancements that are going to become available in the future. So when we talk about these technological enhancements, very often we're looking at those that are on the interface between a brain and a machine or a computer. So some of these technologies are already in use. People with cochlear implants, for example, have machines that are directly connected to their nervous system, and in this way they're enabled to hear. So we also, some technology has also been developed that interfaces between the nervous system of a person who's missing a limb, for example. So prosthetic devices are being developed that connect directly with the nervous system of a human being. Other technologies that are going to be connecting the biological brain of a human with a machine are being developed with the purpose of enhancing cognition. So people are developing brain chips that are going to either enhance people's senses or stimulate their brains to work in a more optimal way. And here again, eventually we are going to meet those dilemmas. Some of us are going to hesitate to try this technology because it's an invasive procedure where we have a machine that is connected directly to our nervous system, which is what we consider to be our personhood. So here that we're going to have these questions about, are you going to be the same person if you use that kind of implant? Does that change who you are? And people are going to be struggling with these decisions. But then we also are going to face some of the ethical issues that we already encountered with physical and pharmacological enhancement, namely people with wealthier backgrounds are going to have better access to these technologies, safer ways to integrate the technology. Then we're also going to have the pressure that some individuals are going to face on enhancing themselves so they can compete with others even if they don't want to. So here's again a huge issue with that kind of approach where we take a medical procedure, medical treatment, and we use it for non-medical purposes. And finally, there's the issue of aesthetic enhancement, which is very well familiar. It's been around for many decades now, and people have had the opportunity to discuss that. So when we talk about aesthetic enhancement, for example, we are looking at plastic surgery as a medical intervention. Obviously, there are other interventions that people use for aesthetic enhancement, such as changing the color of their hair, using makeup. These are all aesthetic enhancements, but in the case of plastic surgery, we're talking about a medical procedure that is used for these purposes. Obviously, we're talking about elective plastic surgery as opposed to reconstructive plastic surgery, where reconstructive plastic surgery typically has the goal of restoring some structure of the human body that is going to restore the health of the patient. But when we talk about elective plastic surgery, we are talking about a very invasive medical procedure that presumably comes with some benefits, enhanced looks, but at the same time comes with severe risks. People have been known to die during plastic surgery, and then here we need to face the big question: do the benefits really outweigh the potential harms of this procedure? And from the point of view of the patient, remember, maximizing well-being is the main point, so they can easily make that decision. But a surgeon who provides that procedure may be facing a moral dilemma. Maybe they can very well estimate that the benefits that the patient thinks they're going to get out of a certain procedure don't really outweigh the harms or the potential risks that come with that surgery. So should they turn the patient away and not perform the procedure, or should they serve the purpose that they have signed up for, namely to help their patients enhance their well-being? So when it comes to making these estimations, looking at the cost-benefit analysis or estimating benefits versus harms, we have three options in order to make that calculation, and we're going to look at each of them individually. So we could be looking at calculating the net good that's going to come out of a certain situation. And these are particularly useful when we're trying to pick one course of treatment over another. So we're going to be estimating the net good that's going to come out of one action as opposed to another, of one treatment as opposed to another, and making that decision. Next, we have another option. We could be looking at maximizing the ratio between benefits and harm when we make these decisions. And finally, we may be looking at minimizing harm. So with the first two options, we're looking at the priority of beneficence. So here the principle of beneficence is key. But in the third case, the principle of non-maleficence is prioritized because here we're trying to minimize harm. So let's see how those different calculations can be used in practice. Suppose we have two courses of treatment that we need to pick between. In the first case, we have some projected benefits that are twice as much as the projected harms. And then in the second case, we have again that situation, but here the potential benefits are double. So these numeric values are often going to be assigned based on some sort of statistical estimation. What's the likelihood of one outcome over another? But also some of these values are going to come from how much the benefit is important personally to the patient who's making those choices. So that combination of estimated likelihood of an outcome together with the personal value could be given that kind of numeric value. So in the first case, we have said the risk here is 1 and the benefit is 2. Clearly the benefit outweighs the risk. But in the second case, we've said, well, the risk is higher. It goes up to 2, but then the potential benefits are even higher. So the potential benefits go up to 4. So if we are calculating the net good of the potential action, we're going to subtract the potential risks, the potential harm from the projected benefits. So in the first case, we're going to have 2 minus 1. In the second case, we have 4 minus 2. Well, 4 minus 2 equals 2. 2 minus 1 equals 1. Clearly, the net benefit from the second course of action is greater than the first one. So if we're using this calculus, we are going to prefer treatment number 2 over treatment number 1. So let's look at this other situation. So here we have projected outcomes for course of treatment 1, again, at potential risk at 1 and potential benefit at 2 in the first course of action. But in the second case, we have projected benefit of 4, but projected risk of 3. So if we use the calculus of estimating the net goods, we're going to subtract 3 from 4 for the second course of action. That's going to give us 1. And we're going to subtract 1 from 2 in the first case, which is going to again give us 1. So here the net benefit that comes from either of the treatments is equal. So we really can't make a non-arbitrary decision in this situation. So here is another way to calculate the possible ratio of benefit and harm that is going to help us make a decision in this case. So here we're looking at the ratio between the two possibilities. So with course of treatment 1, we're looking at 2 over 1, and with course of treatment 2, we're looking at 3 over 2. So 2 over 1 is greater than a 3 over 2, so this calculation helps us choose treatment number 1 over treatment number 2 because that maximizes the ratio between projected benefit and projected risk. Okay, so let's look at this other case in which we're actually back to the first case scenario where we have course of treatment 1 where projected harm is 1, projected benefit is 2, and course of treatment 2 where projected harm is 2 and projected benefit is 4. So if we were to use the method of maximizing ratio here, we are going to face the following equation. We're going to have 2 over 1 for the first treatment and 4 over 2 for the second treatment. But these are equal, so again, we're not going to be able to make a non-arbitrary decision. So you're going to recall then the first calculus we had, we could estimate the net benefit and then make the decision to go with course of treatment 2. However, we have a third way to approach that situation. If we prioritize non-maleficence, if we want to minimize harm as opposed to maximize benefit, we are going to be looking at subtracting again the harm from the projected benefit, where with the first case we're going to have 2 minus 1, that's going to be 1, and in the second case we're going to have 4 minus 2, which equals 2, which means that the potential harm that will come out of course of treatment 1 is lesser than the potential harm from treatment 2. So if we want to minimize harm, here we're going to choose course of action number 1. So you see how we have these 3 ways to weigh benefits against harms and make a decision on their basis. But again, our values here are going to be decisive. So you see how in the same situation where the first calculus was telling us you choose course of treatment number 2, and here the third calculus tells us no, choose action number 1. We need to choose between whether we want to maximize benefit or minimize harm. So whichever is more important to us is going to actually make a difference in making that decision. So with these tools now, we could look at some further applications of the principles of beneficence and non-maleficence. So one case in which we are not going to be centered at the patient themselves is when a treatment is being tested for its efficacy. So in randomized controlled trials, patients who sign up for that experimental treatment may benefit from that treatment if the treatment is successful, but also if they are in the experimental group. But with randomized control trials, remember, we have this blind process in which it's a double blind experiment where neither the patient nor the experimenter know whether the patient is actually given the experimental drug or the experimental treatment. With randomized control trials, we always have an experimental group, but also we have a control group where in the control group, the patients are not really receiving the treatment. They're receiving a placebo. So what the goal of this kind of experiment is to see whether a treatment really works, or whatever benefits the patient is getting, they're getting just because they think they're being treated. So when a treatment is in that process, very often in the process, an experimenter can clearly see that one of the group of patients is making huge improvements based on that treatment. So clearly, the treatment is effective. So here, the medical professional, the experimenter, is going to face this really tough question. Well, we have these preliminary results that the treatment is really working. Should we just terminate the trial and treat everybody and restore their health? Or should we keep going? They signed up for this trial. They were aware that they may be getting a placebo. So we're not going to do something that they did not agree to do. But if we continue with this trial, we can have more decisive results. So maybe these preliminary results show us that the treatment is effective, but we don't know what's going to happen if we continue treatment. So we are not going to know the long-term effects of that treatment. So we need to keep going with the trial. And the benefit that's going to come out of continuing the trial is obviously not going to be for the patients in the control group. It's going to be at their expense, actually. But future patients will benefit once the drug is recognized as effective. Also, the profession is going to benefit. There's going to be a new treatment available for other medical providers. And also, the experimenter themselves is going to enhance their own professional career. So the benefits here are for many others and not necessarily for the patient. So here again, we're going to be concerned with where our values are going to weigh. Is it our obligation to treat the patient when we have a useful treatment, or is it for the profession? Is it for future patients? So here again, beneficence and non-maleficence are going to be involved in these decisions. Here's another case in which beneficence and non-maleficence may be very important in deciding who gets treatment over somebody else if there are limited medical resources. So, for example, we may face the need to decide whether we need to allocate scarce resources to one person or another based on the consequences for society that's going to have. Say we need to pick whether to treat the President of the United States over a very ill child. One of our considerations would be, well, if the the president doesn't receive the proper treatment and their health is not restored, that's going to affect the whole country. It's going to affect millions of people. It's going to affect the government. Everything is going to be in distress. So maybe we should prioritize the president of the US over a very ill child. So then the question will be, should we prioritize a very ill child and leave the president behind? So here there could be multiple different arguments, one of which could be that the child is in dire need of this treatment, they're going to die right away, but the president is not in that of a dire condition. They can wait a little longer. So here again, multiple values are going to be intertwined in those decisions, but definitely the consequences of an action are going to inform that decision. So we are going to be looking at beneficence and non-maleficence. Here's another situation in which the benefits of a medical procedure are not necessarily going to be benefits for the patient themselves. Suppose that a cancer patient doesn't want to undergo chemotherapy, but their family insists on that. Whether the reason for their insisting is because they really can't imagine their lives without that patient, or because their livelihood depends on the patient's health. Maybe the patient is the sole breadwinner in the family. So in that case, the question will be again, is the patient's benefit more important than the benefit that the treatment would have for their family? So that again is going to be a tough decision where beneficence or non-maleficence are going to be involved. Another case in which a tough decision would have to be made, in particular on the part of the professional, is when the question is between the importance of the benefit for a patient and the importance of the benefit or minimizing the harm for the professional's family, for example. Should a very skilled surgeon, who's the only person who can save a patient's life, miss their child's school play performance in order to save that person's life? So that seems like a very easy decision looking from the perspective of somebody who's not directly involved in that situation. Well, of course, the surgeon should go and save that person's life. They can go see another of their child's performances. But if that happens every time, if every time there is a life and death situation, the surgeon prioritizes their patient over their family is going to suffer from that. So that is not going to be an easy decision to make on part of the healthcare provider. So here again, the benefits for the patient are going to have to be weighed against the benefits for other people, in this case, the health professional's family. So finally, let's look at another principle, the principle of justice. When we talk about justice in the context of healthcare, typically we look at the just distribution of scarce or limited resources. So we already looked at that hypothetical situation in which we are trying to figure out whether we should prioritize one patient over another. And when we talk about fair distribution of resources, we are looking at what the right thing to do is in itself. So how is justice performed in that kind of fair distribution? what is the fair thing to do, regardless of the consequences that are going to come out of that distribution. So this is why justice is considered a principle of a deontological framework. So here we're looking at identifying the right thing to do based on that principle of fair distribution. It's the distribution that really matters here, not what's going to come out of it. So because of that, it's very often that justice conflicts with beneficence, especially when we're looking at a utilitarian calculation. So you will recall that utilitarianism is a version of consequentialism where we are estimating the right thing to do based on the consequence for the society as a whole. So the principle here that is often articulated is the greatest happiness for the greatest number of people. So if we are distributing scarce resources, the best way to maximize their utility, the best way to maximize the benefit of that distribution would be to give more resources to patients that need less, as opposed to give significant resources to fewer patients that are needier and would need more help, more attention, and that's going to detract the care that medical professionals could provide to, let's say, the majority of society. So beneficence here is going to tell us distribute scarce resources to the greatest number of people. Justice, on the other hand, is going to tell us this is not going to be a fair distribution. You're giving resources to people who are already better off. So now the gap between the neediest and the most advantaged ones is going to get even greater. So here we're going to say this is not fair, this is unjust. So the right thing to do here is going to be prioritize the people who need those resources the most. Those are the people you need to take care of first, and then attend to the people who are not in such a dire condition, even if they're a greater number. So here you see some very tough dilemmas arising in this context, where we see the clear conflict between justice and beneficence. And we're going to look in depth into some cases and make some tough decisions based on what we've already learned about how to make sound moral judgments and refer to the moral values that we've articulated, as well as the principles of medical ethics.